Here's a USMLE style question on oligodendrogliomas. A 35-year-old woman presents with a history of seizures and progressive headaches over the past few months. Neurological examination reveals no focal deficits, but MRI of the brain shows a well-circumscribed tumor in the frontal lobe with calcifications. Biopsy reveals the tumor consists of uniform round cells with delicate fried egg appearance, along with perinuclear halos and dense calcifications. Which of the following is the most likely diagnosis? A. Glioblastoma multiforme, B. Oligodendroglioma, C. Astrocytoma, D. Meningioma, E. Schwannoma. Answer B. Oligodendroglioma. Explanation: this patient most likely has oligodendroglioma, a type of glial tumor that arises from oligodendrocytes, the cells responsible for myelinating the CNS. Oligodendrogliomas are typically well-circumscribed tumors and most often occur in the frontal or temporal lobes. They are most commonly seen in young adults, ages 30 to 40. The MRI findings of a well-defined tumor with calcifications are characteristic of oligodendrogliomas, which often show calcifications on imaging. Histologically, the tumor cells exhibit the classic fried egg appearance, round, uniform cells with clear cytoplasm and perinuclear halos, and dense calcifications. Oligodendrogliomas have a relatively good prognosis compared to other gliomas, and they are often chemosensitive to agents like temozolomide. Key features of oligodendrogliomas: location, commonly in the frontal and temporal lobes; age group, most commonly seen in adults, 30 to 40 years. MRI findings: well-circumscribed lesions with calcifications. Histology: fried egg appearance, perinuclear halos, and calcifications. Genetics: associated with 1p19q co-deletion, which is a favorable prognostic factor and predicts better response to chemotherapy and radiation. Differential diagnosis: glioblastoma multiforme GBM typically presents with necrosis and vascular proliferation. MRI often shows irregular, infiltrative borders and is usually not well circumscribed. Astrocytoma tends to involve astrocytes and presents with a more infiltrative pattern without the classic fried egg appearance. Meningioma typically presents as a well-circumscribed extra-axial mass attached to the meninges, often with a dural tail on imaging, and does not have the fried egg appearance. Schwannoma most commonly involves the peripheral nervous system and is associated with nerve sheath origin rather than glial cells.